welcome. We're busy with part number 4 in ADHD, attention deficit hyperactivity disorder. Attention is low, activity is high, like a seesaw at the park, right? So I repeat a lot of the things in these various programs as a reminder to ourselves and for the viewers, and in case you got your ADHD children sitting and listening, because I'd like to keep things simple. And the way the brain works is that repetition is important. So some of the key concepts in each of the videos, I'll repeat the same key concept because that's how the brain works. So it goes from short-term memory into long-term memory. Okay, so this whole program series is about ADHD. Let's create awareness about this condition, and whether it's your child got ADHD or autism spectrum disorder or any other mental health issues arising out of maybe drug abuse or substance abuse, or maybe trauma in the house, maybe the child is going through a grief, maybe the mother passed away or the father passed away or a sibling or a best friend passed away. So everyone goes, or maybe it's post-COVID, even adults and children go through post-COVID mental health issues. So the principles that I'm talking about under ADHD are not specific for ADHD. Is with any person, adult, male or female, adult or young, who's suffering from some or other mental health issues or neurodevelopmental issues, problems to do with development of the brain. The main thing about the problem with the brain is that sometimes because of ignorance, there's normally a stigma attached to it. So let's remove the main purpose of my focus here is to remove the stigma. Sometimes when you tell people, oh, he's got a problem with the brain, they think, oh, maybe he's crazy, there's something wrong with him, stay away from that kid. These are the stigma arising out of ignorance. So we need to remove the stigma, and the best way to remove the stigma is through knowledge. And the only way to get more and more people to understand mental health issues is by what? By sharing. So please share this with other people. Share it with the teachers. Share it with your friends. Share it with family members. Put it on your social media groups. The main thing is share, share, share. If you don't have knowledge, it is a state of darkness. Darkness means absence of knowledge. If you are ignorant, it means you are in darkness. The minute you have knowledge, if you are sharing knowledge, you are lighting up the world. I'm sharing my knowledge with you. I'm lighting my candle with your candle. You light your candle with another person. That means you're sharing that knowledge. As we get more people sharing the knowledge, everyone's candle is lighting up. So we're replacing darkness with light. So let's share knowledge. Let's remove the stigma. So today we are on episode number 4. We are planning to do a series of 12 programs, inshallah. Right. So today's program, as I said, I'll mention, and so please, I will repeat because repetition is important. So please help me make the world a better place. Let's make the world a better place together, all of us together. Let's make the world a better place. Let's make South Africa a better place. Let's make Africa a better place. Let's make India a better place. Let's make Pakistan a better place. Let's make Dubai, America, Europe, Australia, Poland, France, Germany, Sweden, Switzerland. Let's make all places of the world, Canada and Brazil and Argentina. Let's make the world a better place. All of us together by what? By sharing knowledge. Let's share knowledge. That's the main thing, how we make the world a better place. Okay, so today we're just going to focus a bit on questionnaires. If you don't worry too much about the details, here your doctors and the ADHD experts will know more about this. I'm just saying this just to give a complete answer on ADHD. Don't worry too much about the technical details. There are some difficult parts to today, but I'll try and keep it as simple as possible and revise some of the concepts which we mentioned in the earlier programs. So the ADHD questionnaires and rating scales are helpful. Are very, very helpful. You can't do a blood test for ADHD except for the lead. So in case there's high lead levels, it'll just give you a clue. I apologize with the flu. We have a sore throat and my head is pounding at the moment. Spine isn't a problem, but I'm not complaining. Don't worry about my problems. I'm concerned about the people. I'm concerned about my patients. I'm concerned about humanity. I'm concerned about those mothers and fathers who got ADHD children in their home and they don't know what to do. They don't have solutions, especially in South Africa or in third world countries. We don't have the resources. First world countries are fabulously funded. They are so far advanced and the children are picked up early. The teachers are super intelligent. They'll be able to pick it up. Teachers are like psychologists there. And they got psychologists on the school ground. So they got counselors on the school ground. So for those of us who are suffering, I just want to share this knowledge. Please, let's share knowledge. So the ADHD questionnaires and rating scales are helpful when trying to make a diagnosis of ADHD. Some questionnaires are for parents specifically, some are for teachers. So always remember, when you go visit your doctor or the ADHD expert, always take a logbook with. Remember in the previous program, keep a diary logbook, a checklist of how your child is behaving, what are the things that trigger your child, and take that with you whenever you have to fill in these questionnaires. That is a history that's very, very important. You as the mother, or you as the father, or you as the teacher can provide valuable information to the doctor. That data, your history, that's the most important part that's going to give us the diagnosis. We will then decide that is it ADHD or is it something else, because there are some other conditions that are similar to ADHD and may not necessarily be ADHD. Please remember that a person who's got ADHD or autism spectrum disorder or other problems does not mean that the person is stupid. Okay, we must remove this term stupid away from it. And I will do another program, entire program just on different types of intelligences. There are some parts of the brain where these kids are super creative, super intelligent. There are some who are known as calendar intelligence. They will be able to tell you the date, time of a specific date in the calendar in a few seconds like this. We've seen so many kids on Britain Got Talent who can do mathematical formulas like this. So we need to find the skills in which your child with ADHD is super intelligent. Sometimes you can achieve it, sometimes it's difficult, but treat that child with respect. That's the main thing. Treat that child with respect. Please treat the parents with respect. Imagine what the parents are going through. Imagine what the mother is going through. So have concern and compassion, and don't think there's something wrong with that family or there's something wrong with that kid. So let's treat each other with respect. The interviews and questionnaires are for the teachers, and together with the school reports. And for adults, the screening for adults is a bit different. The doctor may want to talk with your spouse or other family members. They want to find out if you had symptoms in childhood. The diagnosis of ADHD, doctors use guidelines established by the APA, the American Psychiatric Association, and the group has identified 3 different types of ADHD. One is called the inattentive ADHD. The inattentive ADHD where the attention level is low, and then the hyperactive-impulsive ADHD, and then a combination of the two. So you'll either have an inactive one, that's the AD part, or the hyperactive one, the HD part, or a combination. And usually it's a combination one that's the most common type. So the inattentive one, this one here, let's see some of the features. Doesn't pay attention to detail, makes careless mistakes, doesn't stay focused, doesn't listen, doesn't follow instructions, doesn't complete the homework, doesn't do the chores and duties, has trouble organizing tasks or activities, avoids or dislikes doing things that take effort or concentration, loses a lot of things, doesn't focus, is easily distracted, is easily forgetful. The hyperactive impulsive type, this one here, this one fidgets a lot, squirms a lot, gets up from the seat a lot, runs or climbs at inappropriate times, has trouble sitting or playing quietly, always on the go as if there's a motor engine, there's V8, V12 engine, on the go all the time, talks too much, blurts an answer before the question has been completed, has trouble waiting their turn, interrupts others, makes the classroom a living nightmare for the people. In the house, he's like a tornado has come there, he's like an ocean out there, or like a storm that's coming through. This one is more subdued, this one is more hyperactive, and then you get the combination. The majority of them are a combination, some of these features and some of these features. So the AD rating scales, there are different types of rating scales. One is called the Vanderbilt Assessment Scale. This scale reviews symptoms of ADHD, looks for other conditions such as anxiety and depression. The second one is called the Child Attention Profile. The CAP is generally filled out by teachers. Then you got the Behavior Assessment System for Children called the BASC. It looks like things such as hyperactivity, aggression, and conduct problems. Also looks for anxiety and depression. And then you have another one which is called the CBCL, the Child Behavior Checklist, or a report from the teacher. This is very important. So you see how important the interaction with the teacher is. And if the teachers are not aware of ADHD or not educated enough, then how can the teachers even help the doctors or help the parents? So among other things, the CBLC looks at physical complaints, aggressive or delinquent behavior and withdrawal, how they perform at the playground, how they interact with other kids. And then we have the famous Connors rating scale. It looks at things such as behavior, work or schoolwork, and social life. It can show how these symptoms affect things such as grades, jobs, home life, and relationships. So please remember, let's remove the stigma. Let's remove the stigma, and then join me. Today we've done session number 4. Join me for the next one, session number 5. Stay well, look after yourself, and share knowledge. Share knowledge, share knowledge, share knowledge. Thank you. Stay well, look after yourself.